Maybe
Okay, I
to,
just recorded it. Now share. And then I'm sure we could crop the video, right?
Yeah, I'm sure we can.
Okay.
Hello, everyone. My name is Ryan Brownlow, and I'm joined by Nakisha Scott and Maya Bell. And we're going to be presenting a few different routes of administration techniques that are commonly utilized in the elderly population.
All right. So the first administration technique we'll be talking about is eye administration. You could be administrating eye drops or eye ointments for many reasons, like glaucoma, age-related macular degeneration, dry eye syndrome, or conjunctivitis. Eye drop administration. So before we start with all of these administration routes, the most important thing to do first is to wash your hands thoroughly, and you may apply gloves as well afterwards. So wash your hands thoroughly. Next, you'll want to perform the patient's rites. So that would be the right time, the right medication and strength, the right route to the right person, and into the correct eye. Then you're going to gently tilt the patient's head backwards and have them look upward. You'll pull the lower eyelid outward and create a pouch. And then you're going to place the dropper over the patient's eye, but not touching the patient's eye. And you're going to administer the drop into their eye. You want to allow the patients to close their eyes for at least 1 or 2 minutes, and they can roll their eyes around to distribute the eye drop around their eye. And then you can use your finger to apply pressure to the tear ducts in the inner opening of the eye to decrease systemic effects. It's important that if they have multiple doses of that medication in one eye, that you wait at least 5 minutes before applying the next drop. And then you want to replace the bottle cap without touching the dropper tip to any surface and wash your hands thoroughly again. Eye ointment administration is almost the same. It's important that you want to warm the tube in your hands before applying the ointment, just so it's not too cold. It's also important that you clean the affected eyelid with warm water. Gently just wipe the eyelid. So you want to create the pouch again, and then squeeze a thin line, like a 1/4 to a 1/2 inch of ointment along the pouch. And then you want the patient to close their eye and rotate their eyeball again to distribute the ointment. They can blink several times just to help them evenly spread the ointment out. And the vision may be impaired or blurred temporarily, so that's why these ointments or gels are taken at nighttime. So it's just important to let that be known.
Next up, we'll be moving to ear administration. There are many different types of ear conditions that are treated by the use of ear drops. Some examples of these conditions are bacterial infections such as acute otitis media and swimmer's ear, as well as fungal infections such as mycotic otitis externa and earwax buildup. There are several different steps that need to be followed when administering eardrops to a patient. First off, you need to check to make sure that the medication administration record is consistent with the doctor's orders. Secondly, you want to make sure you wash your hands to clean them of any additional bacteria. Next, we're going to be moving on to performing your 7 rites at least 3 times. And so your 7 rites involve having the right patient, having the right medication, having the right dose, the right route of administration, the right time, making sure to adhere to the right prescribed dose and schedule, the right reason, and the right documentation. So following these 7 steps ensures that there will be no medication administration errors. Moving on, you want to make sure that you put on some clean, non-sterile gloves. And then you need to make sure that you cleanse the external ear of any drainage using a warm, wet washcloth. Next, you'll be positioning your patient with their affected ear facing upwards, and then you'll be able to draw the medication into an eardropper, and you'll be making sure the dosage is correct. Gently pull the ear pinna back and up, and you'll be holding the dropper tip just above the ear canal. Allow drops to fall on the side of the ear canal. Release the ear pinna then and have the patient remain in this position for at least 5 minutes. It's sometimes helpful to apply some gentle pressure several times to the tragus to make sure that it is completely absorbed. Next, you'll be removing your gloves and assisting your patient to a more comfortable position. And lastly, you will want to wash your hands once again. There are many different types of nasal conditions also that are treated by the use of nasal spray. Some examples of these conditions are allergic rhinitis, also known as hay fever, which is caused by seasonal allergies. Additionally, there's non-allergic rhinitis, which is characterized by a chronic sneezing or a congested, drippy nose with no apparent cause, which is usually seen when a patient has the common cold. Also, another condition is nasal polyps, which are painless, benign growths on the lining of the nose or sinuses. And same as for the ear, it's there's several steps that need to be followed when you're administering nasal sprays to patients. First, you need to make sure that the medication administration record is consistent with the doctor's orders. You need to make sure that you wash your hands thoroughly. And then you can make sure you do those 7 rites that I referred to earlier at least 3 times just to double check everything. Next, you'll want to check the label for the name, the dose, the route one more time before you get going, and then you'll go ahead and put your clean, non-sterile gloves on. Using gloves, protects the nurse or whoever is administrating from any potential contact with any body fluids or medication. So that's a smart step to have there. Next up, you'll want to provide the patient with tissues and ask them to blow their nose. This actually clears the nose prior to medication installation. Then you want to position the patient sitting back or lying down with their head tilted back. You'll want to ask the patient to breathe in through their mouth during this time. And if you're administering nose drops, you'll want to draw the fluid into the medication dropper with enough for both nares. And then you'll want to hold the dropper about 1 centimeter above the nares and drop medications into one at a time. If you're using a nasal spray, you'll want to have the patient hold one nostril down and breathe gently through the other as the spray is being administered. After this, you'll want to position the patient with their head back for at least 2 to 3 minutes, and this position prevents escape of the medication to run out of the nose. And then you'll want to remove your gloves, assist your patient to a more comfortable position, and then you would want to wash your hands again.
All right, so now we'll talk about injections specifically for diabetes. So the injection sites you can use include the upper outer arms, the abdomen, the behind, and the upper outer thighs. It's important that you use the same area every day, but you want to rotate around that area so that the patient has less adverse reactions to that site. First, I'll talk about bowel administration. So what you want to do is gather all your supplies, and like we said before, wash your hands thoroughly. You roll the bowel between your fingers while inspecting the bowel for particles, clumps, or weird colors. Then you'll uncap the insulin valve and use an alcohol swab to swab the top of the valve, cleaning it. And then you'll also use another alcohol swab to clean the injection area on the skin of the patient and allow that to dry. You uncap the needle and you'll pull the plunger down to the amount of insulin you need. And then you'll insert the plunger or the needle into the vial and depress the plunger, adding that air into the vial. Then next, you'll invert the vial with the needle still in and pull the plunger back to the amount of insulin that you need. And then you'll place free hand around the injection site on the patient and inject the needle at a 90-degree angle. And then you want to hold for 5 seconds. And after you remove the needle, just place a cotton swab on the injection site for 5 seconds. And it's important to dispose the syringe into a sharps container and wash your hands. And then next with pen administration, you'll want to gather your supplies, wash your hands, and you want to swab the rubber stopper of the pen top with the alcohol swab. And then you need to screw on a new needle tip. So you prime the pen. And to prime the pen, you shoot 2 units of insulin into the air, and then next you'll just dial up your desired dose. Clean the skin of the injection site with an alcohol pad. Then you'll place your free hand around the injection site and inject the needle at a 90-degree angle to the patient. You'll press the button to eject the insulin. and hold for 5 seconds. And then once you take it out, again, place a cotton swab around the injection site for 5 seconds. You'll unscrew that pen needle tip and also dispose of that into a sharps container.
Okay, so next we will now go over how to administer a transdermal patch. Some common drugs that are used as a transdermal patch are nitroglycerin, estradiol, testosterone, fentanyl, lidocaine, oxybutynin. So as we stated before, it's very important to use hand hygiene, so washing your hands. You also want to explain the procedure to the patient and make sure they understand exactly what you are doing and why you are using the patch. So you also want to remove the old patch if it is on the patient and make sure you dispose it properly. Then you want to find and choose an appropriate site to place the new patch on. If the patient is confused, you want to choose a site where the patient cannot remove the patch if possible. You want to check the skin to make sure it is intact and not irritated. You also want to avoid hairy areas and remove hair prior to application. Then you want to make sure you clean the area and wait for the area to dry before you apply the patch. You want to take the patch out of the packaging and make sure you peel only half of its protective layer just to make sure when you go to apply the patch, it will adhere to the person's skin. You want to place the patch on the skin and press firmly down for at least 30 seconds. And after you do that, you want to make sure that it was adherent to the skin. Once you do that, when it's time to apply a new patch, you want to make sure you are rotating the site each time when applying. Just some clinical pearls you should remember when using a patch. You want to avoid removing protective wrapping from the patch if you are not ready to apply it. You also do not want to use a patch if it has been cut, damaged, or altered. Yes, some patches can be cut, but you want to make sure you are only cutting the patches that are instructed for you to do so. You also want to avoid irritant agents such as lotions and oils that can irritate the skin, and you also want to avoid exposing the application to this application site to heat. So you don't want to apply heat to the site. So next, I will discuss medications that are required using the route of inhalation. So some common drugs are albuterol, Brilinta, Proair, Spiriva. So different medications that are utilized in patients who has asthma and COPD. So I will particularly be talking about how to help your patient use a meter dose inhaler. So as we discussed before, you want to make sure you do practice hand hygiene. So you want to remove the inhaler cap and remind your patient to make sure the mouthpiece and spray is clean. So you want, even if you are assisting your patient, you want to make sure the mouthpiece and the spray area is clean. You want to shake the inhaler for at least 10 seconds and then prime the inhaler if it is being used for the first time or if it has not been used in the last 14 days. When you prime the inhaler, you need to spray at least 3 to 4 sprays in the air. If a spacer is needed, you want to prompt the patient to place the mouthpiece on the end of the spacer, or you can do that. The patient should be sitting up or standing up straight. You want to then tell the patient to take a deep breath in and breathe away prior to them doing their first inhalation. Patients should then place their lips around the mouthpiece or spacer, and the mouthpiece should be placed between their teeth and above the tongue. The patient should then tilt their hair back slightly and press down on the inhaler one time, or you can make sure if they need help with pressing down, you can do that as well. The patient should take in a deep breath. If a spacer is being used, you want to listen for a whistling sound. If there is a whistling sound, tell your patient to slow down their breathing. Once they breathe in, they should hold their breath at least for 5 to 10 seconds or as long as possible. And you want to make sure they let their breath out slowly. If another puff is needed, you just redirect the patient through some of these steps. So just some clinical pros involvement and the use of an inhaler. You want to make sure that the patient does clean the mouthpiece weekly or the mouthpiece is being cleaned weekly. You want to also remind the patient to wash hands prior to administration. You want to explain and educate the patient on why they should rinse and spit after the use. And you also want to remind the patient to shake the inhaler well prior to using it. So I hope you all enjoy our presentation, and I hope you have learned some things and different things about the routes of administration. Please feel free to contact us if you have any questions. Thank you.
Awesome job, people.